Move the cane with what? Weak leg, just like walker. But which side do you hold the cane? If you have a bad leg, right hip fracture, you keep the cane on the good side, on the left side. Now you move the cane and you move the weak leg together. Weak leg, same in walker. There's no difference. Read your question. You move walker and weak leg together. Cane, you move weak leg and cane together. Are we okay? And cane flexion, I want you to add there 15 to 30 degree. So your arm should be bended 15 to 30 degree. Very important that we understand ambulation. We already talked about positioning for Nclex. You cannot move without knowing these things. These are nursing. Next is myelogram. X-ray visualize the spinal canal by injecting the radio-opaque dye. And hydration is important, but only thing you remember is if the water-soluble dye, you elevate an oil-soluble flat. That's important. So you should know the positioning after patient returns from myelogram. Next page, we'll move on. On page 27, enema may be given, avoid sneezing. They said bed rest and encourage fluid. Laminectomy goes in your spinal cord. A laminectomy goes in neuro. So patient returns from laminectomy. They have removed the lamina and exposed the affected area. So what would you do post-op care, pre-op care? Heat you can apply for pain. Fowler's position, isometric exercise for abdominal muscle, you teach them, and maybe NSAIDs for pain medication, analgesic. What is NSAID does? Reduce the inflammation, not only for pain, for inflammation, and TENS unit for pain, you can use it. After the patient, so this is laminectomy question, and that goes in your neuro, and patient come back after laminectomy, always think about, they're talking about the back and the neuro system. And what do you do is circulation. How do you turn them? Log rolling. All your patient with spinal cord injury and laminectomy, you roll them in one piece. Are we clear? That is a log rolling. You don't want any back to get hurt. And also, calf exercise assist with ambulation. Underline the word keeping the back straight. All your spinal cord, laminectomy. Now avoid twisting anything in there. Muscle relaxant, NSAIDs you can give them, and analgesic you can give them. Avoid prone position and heavy lifting, and avoid sitting for a long time. Those are important. Don't let them go on the back. Don't let them sit. Avoid the back. And remember, all your exercise are good. Now, the next thing is dysplasia of hip assessment. After this, we'll take a break. So, a dysplasia of hip is in the peds. So, write down on the peds question. It's in the babies who are born with dislocation of the hip. Are we clear? So babies are born and they're born with hip dislocation. What would you see when the babies are born with dysplasia of hip, sign and symptom? Number one, uneven gluteal folds. Their fold of the buttocks are uneven. They're not same. So if you have hip problem, your buttocks are not going to be. So if you take a baby and you look at, the buttocks are going to be up and down. Are we clear? So uneven gluteal, and we say gluteal folds are the buttocks fold right here. That's a gluteal muscle. Limited abduction of hip. What is abduction? Remember, ad means adduction. Abduction means away. Limited. They cannot open their legs. So what are they having? Adduction. Are we clear? So adduction, orthogonally sign. What is orthogonally sign? If you place an orthogonally sign is done by the physician. There was a question somebody was doing, and they said, who will do orthogonally sign? There was a question, is done by the physician. And what are they doing? They place the baby on the back, and the legs are flexed and clicking around, underline the word click sound with abduction. So what the doctor is trying to do, they take the baby's leg and they are abducting. What is abduction? Away. And so when they do away the leg and they hear the click sound. So what is it called? Alternately sound. Are we clear? So what are the three things are the sign of baby's hip dysplasia? Is number one, is uneven gluteal fold. Adduction word. Number three, remember, is alternately sign. That means you hear the click sound when abducted. Who does that? The physician. Next is shortening of the leg. Always remember, when there is a hip problem, the leg is going to be shorter. How do they treat the babies? Comes in exam. And these are, everyone should know, newborn baby, 6 months, they use pelvic harness. For 3 to 6 months, it's like a sling. If you go home and look in your Saunders book, in the ped section, they have pelvic harness. It's like a sling goes between the leg and they're keeping the hip together. Are we clear? So, and what do we use it? So anywhere they give you pelvic harness is used for the babies for hip dislocation. You should know. Next is how long they can leave this. For 3 to 6 months, they will leave it on. And also, after, so remember, leave it on 24 hours. You do not remove. You can change the diaper, but you do not remove pelvic harness. Are we clear? So they ask in the exam, does the child has to wear continuously? Yes. And check the skin assessment, but do not remove. 6 to 18 months. After that, if it didn't help, they may use bilateral. What is bilateral? Is both sides. Is Bryan traction. Bryan traction and hip Spica Cast. And if they become older and it didn't help, then what do they do it? Now we all know what is hip Spica Cast is. And I'm going to give you the pages with the pictures. It goes right from here on the stomach and they apply up till the hip and goes in the leg. And they have a little bar. So always remember, hip spica go cover the abdomen. So what do you assess? Abdominal pain. What do you assess? Nausea and vomiting. What do you assess here? Constipation. So any hip spica cast is applied right from the abdomen, covering the hip and covering the leg. Are we clear? So that's a hip spica. If it didn't help in open reduction. So dysplasia of hip goes in your PEDS question. Everyone should know alternately sign. Everyone should know pelvic harness, that is put it on the babies for using them continuously for 6 months, from newborn to 6 months. If that didn't help, then they will move on to Bryan traction or hip spica. If that didn't happen and they become older, they may have open reduction, mean they have to do the surgery. Are we clear? And they're going to do it, but they try to fix it is without the surgery. Let's take a break for 10 minutes and then we will continue the next. Okay.